COVID-19 has united the world in an immeasurable way. While many have struggled with the effects of this global pandemic, it has had more consequences on some of the most vulnerable populations, with adolescent girls being some of the most adversely affected. The president shut down schools in March as a way to limit the spread of COVID-19. Then, there was no clear plan of when schools would be reopened. Without the support system of teachers and schools, which have now proved to have been safe spaces for children, many girls were left vulnerable to teenage pregnancy, child marriage, and defilement, among other vices. 17-year-old Viola Berochan has been attending antenatal services at Pakwach Health Center 4. She is 6 months pregnant. Berochan says that after schools were closed, she went to visit an aunt whose daughter convinced her to get a boyfriend.
He's also a student, senior 6 student, and he is going back to school. But I told my mom that the owner of this pregnancy, he wants to run away, and I don't know what to do.
At Pakwach Health Center, Vivian Alike, a midwife, says the facility receives 500 mothers seeking antenatal services every month. Of these, 200 are teenage mothers. Between April and June, in the sub-counties of Alui, Pakwach, Panyango, Panyimur, and Wandei, a total of 577 girls aged between 15 and 19 got pregnant, with a good number of them getting HIV. The indicator shows that the teenagers are not only vulnerable to early pregnancy, but are also at a risk of acquiring HIV, other STIs, and other pregnancy-related complications. In LANGO sub-region alone, worrying statistics reveal that over 8,000 teenage pregnancies had been registered between April and June. In Oyam district, 1,833 teenage pregnancy cases were registered between April and June. 1,198 teenage pregnancy cases were registered in Kwale district. 914 were registered in Kwanya district. 790 teenage pregnancy cases were registered in Apak district. 472 cases were registered in Otuke district. A total of 8,717 teenage pregnancy cases were registered in LANGO sub-region alone between April and June. District Health Officer Dr. Paul Ajal says Pakwach has been grappling with the matter of teenage pregnancy for a while, but the number skyrocketed during the lockdown.
Girls dropping out of school, which existed even before the lockdown. And when these girls drop out of school, they're definitely the next thing they're exposed to is getting into a house and starting a family.
Charles Owekmeno, the National Coordinator for Sexual Reproductive Health Alliance Uganda, terms the situation as a looming national crisis that needs immediate attention.
Already the girl child has been struggling with education, they have been struggling with schools, but this means that virtually majority of these young people will actually drop out of school, and for their future is completely ruined, their career is ruined there. So how do we still get these young people back on the development track is a national question that we must answer urgently.
Meanwhile, as he addressed the nation on National Teachers' Day, President spoke about the matter.
So when you are talking, oh, the children got pregnant there, okay, if they got pregnant, at least they are alive.
As schools reopen for candidates to complete their academic year, a huge number of those remaining at home remain vulnerable. Some schools have barred expectant mothers from reporting to complete their academic year. Olivia Komugisha, NTV News.